Okay, so picture this. You're in labor, about to give birth to your first child. The nurses handling your delivery literally finished training yesterday. The doctor is asleep in the next room. For 24 hours, machines are screaming warnings that your baby is dying. But the skeleton crew ignores it all because hiring proper staff would hurt the CEO's yacht fund. Welcome to American Healthcare, where a Utah judge called one hospital chain the most dangerous place on the planet to give birth. That family won nearly $1 billion. The CEO, he was literally sailing the Mediterranean on his $40 million yacht when the verdict came down.
A couple was awarded over $950 million for a medical malpractice case. The couple, they lived in Wyoming. They were traveling through Utah. They went to a West Valley hospital. The woman was pregnant. She had a baby. The nurses had just graduated or finished their training or something. The doctor was sleeping. Nurses gave the mother way too much medicine, made it so the baby came out with a lot of brain problems that caused trouble for the family.
Meet the $951 million baby, the largest medical malpractice award in Utah history, and a perfect bloody microcosm of everything wrong with corporate healthcare. In October 2019, Anissa Zancanella went into labor at Jordan Valley Medical Center, owned by Steward Healthcare. What happened next was a 24-hour masterclass in corporate negligence that destroyed a family. Here's the Steward formula for disaster. Inexperienced nurses who just finished training were assigned to handle a high-risk delivery. They pumped dangerous doses of labor-inducing drugs into Zancanella for hours, while warning alarms screamed from the monitors. The on-call physician, fast asleep in a nearby room, probably dreaming of his next dividend check. When fetal distress became unmistakable, blood pressure spiking, clear signs the baby was fighting for oxygen, the corporate mandated skeleton crew ignored it all. The cesarean section that should have been performed immediately was delayed by over 24 hours, leaving baby Azalee oxygen deprived and causing permanent brain damage, seizures, and a lifetime of disability. Judge Patrick Corum didn't mince words, calling Steward Healthcare the most dangerous place on the planet to give birth. He noted the incredible amount of vendor invoices outstanding, which is legal speak for they couldn't even pay for basic medical equipment. But here's the kicker. The family may never collect that nearly $1 billion award because Steward filed bankruptcy. Where was CEO Ralph de la Torre during the trial? Literally sailing around the Mediterranean on his $40 million yacht. Because nothing says, I care about patient outcomes, quite like being unreachable on international waters while families sue you for killing their children.
And it's really important to keep that in mind. This was a 100% healthy child, 100% healthy mom, but a 100% chance of a healthy delivery. This hospital and this staff created the danger by overutilizing Pitocin and then failed to recognize that danger and then failed to remedy that danger. Quite literally, Anissa would have been better off delivering this baby in the bathroom of a gas station.
Let's talk about Ralph de la Torre, the man who perfected the art of buying luxury boats with baby blood money. Over 4 years, this absolute sociopath extracted over $250 million from Steward Healthcare through salaries, dividends, and benefits, while patients literally died because medical devices had been repossessed. Ralph's portfolio of greed reads like a Bond villain's shopping list. 2 luxury yachts worth $55 million combined, including the 190-foot Immoral that cost $40 million alone. 2 private jets valued at $66 million, an $8.1 million Madrid apartment purchased with company funds, multiple Costa Rican properties, and a Dallas mansion in the same neighborhood as George W. Bush, because nothing says man of the people like being neighbors with war criminals. In 2022 to 2023 alone, he took 582 private jet flights, nearly half to non-business destinations. 84 trips to Costa Rica, 34 days lounging in the tropics during summer 2023 while his company was literally failing and patients were dying. Meanwhile, at least 15 patients died due to equipment shortages and understaffing directly caused by Ralph's greed. A young mother died from liver bleeding after the life-saving medical device was repossessed weeks earlier due to unpaid vendor bills. Cancer patients collapsed waiting for care in overcrowded emergency departments. Deceased newborns were placed in shipping boxes when proper bereavement containers became unavailable due to cost cutting. The contrast is breathtaking. Ralph spent more on yacht fuel in a month than many of his hospitals spent on life-saving equipment in a year. When your hobby budget exceeds a hospital's medical supply budget, you might just be a psychopath with a medical degree. But Ralph's masterpiece wasn't buying boats. It was engineering one of the most destructive wealth extraction schemes in healthcare history. In 2016, Steward sold its hospital real estate for $1.25 billion to Medical Properties Trust, then immediately leased the properties back. Think of it as selling your house to a loan shark, then paying them twice your mortgage to live in your own bloody kitchen. Here's where it gets properly mental. Steward sold these properties at prices roughly 9 times above market value. 9 times! They literally convinced investors to massively overpay for hospital real estate, creating £350 million in annual rent obligations that would strangle the hospitals to death. The deal generated $789 million in dividends that went straight into executives' pockets, including $81.5 million to Ralph personally in January 2021, while his hospitals were failing and patients were quite literally dying. When your dividend payment could fund a small country's healthcare system, but you're using it to buy a second yacht, you've officially crossed into comic book villain territory. The sale-leaseback model is financial sociopathy disguised as business strategy. Basically, you strip every valuable asset from essential community services, load them with unsustainable debt, extract maximum wealth, and then walk away while patients literally die from the consequences. It's not just immoral, it is systematically lethal. And Ralph wasn't alone in this scheme. Medical Properties Trust, the real estate vultures that enabled this disaster, saw its stock price crater from over $20 to under $5 as the reality of their healthcare death machine became undeniable. When your business model depends on hospitals being too poor to afford medical equipment, you might want to reconsider your life choices. But Ralph and Steward are just the tip of a massive iceberg of healthcare destruction. Private equity firms have transformed healthcare into their own personal ATMs, and the results are measured in body counts and shattered communities. Let's talk about KKR's BrightSpring Health Services, where executives doubled their salaries while paying staff $7.50 an hour to care for severely disabled patients. The predictable result? Warren Chapman III, a 6'4" autistic man, choked to death on lunch meat while unsupervised because his caregiver had only 3 weeks of training. Lisa Smith was found tightly wrapped in a comforter as a makeshift restraint and died 12 days later from her injuries. State inspectors found 118 instances of dangerously low staffing and 40% of serious safety citations, despite BrightSpring owning only 16% of facilities in the analyzed state. When you're systematically worse than everyone else, that's not bad luck, it's a bad business model. Cerberus Capital's Steward acquisition generated $800 million in profits for the private equity firm while creating the conditions for systematic patient deaths. Their playbook, leveraged buyouts, asset stripping, dividend recapitalization, and strategic bankruptcy, has been replicated across dozens of healthcare acquisitions, leaving a trail of closed hospitals and dead patients. Apollo Global Management owns 220 hospitals across 36 states, where a Senate investigation found systematic patterns, including sexual assault of incapacitated patients by undertrained staff. Although I think that's less of a training issue, to be honest. At one Iowa hospital, a male nurse sexually assaulted multiple female patients before dying of a drug overdose. while Apollo collected millions in management fees despite unfulfilled promises and underinvestment. The private equity playbook is depressingly consistent. Acquire healthcare facilities with massive debt, strip valuable assets through sale-leaseback deals, extract wealth through management fees and dividends, and then file strategic bankruptcies that protect executives' wealth while abandoning patient care obligations. It's financial engineering designed to kill. Want to see private equity healthcare sociopathy in its purest form? Meet Joel Freedman and the Hahnemann University Hospital closure in Philadelphia. Freedman bought the hospital for $170 million in 2018, immediately split the operating business from the valuable Center City real estate, then filed bankruptcy within 18 months. During the COVID-19 pandemic, when Philadelphia desperately needed hospital capacity, Freedman demanded $1 million per month in rent for the city to reopen the hospital for pandemic response. $1 million per month to use a hospital during a pandemic. Let that sink in. The closure eliminated 2,572 jobs and left downtown Philadelphia without a safety net hospital serving the city's neediest residents, while Freedman retained prime real estate worth hundreds of millions. He literally held a city hostage during a pandemic for profit. Now, if that is not evil, I don't know what is. Then there's Prospect Medical Holdings, where Leonard Green and partners extracted $645 million since 2010, while hospitals literally couldn't afford elevator repairs or ambulance gas. The CEO Sam Lee accumulated $90 million in total compensation and owes $20 million in properties, including an Aspen home, while patients were wheeled across public streets because elevators were broken and unfixable due to unpaid maintenance contracts. So picture this. You're having a heart attack, and instead of being rushed to the cardiac unit, you're wheeled across a public street in LA traffic because the hospital elevator hasn't worked in months. Also, some private equity parasites can buy another ski chalet.
The thing is, you got a fee to pay. When they transport you to another hospital, there's a fee that's going to come behind the transportation. And the fee that a whole lot of poor people can't meet it.
This healthcare greed isn't uniquely American. It is a global disease infecting every corner of the medical world. In the UK, private companies have extracted £6.7 billion in profit from NHS contracts since 2012. That's £10 million per week leaving public healthcare. United Health Group, already America's 10th largest corporation with £324 billion in revenue, is systematically colonizing UK healthcare through its Optum subsidiary. Australia's healthcare corporations have perfected patient exploitation. Healthscope, owned by North American private equity, $1 trillion globally, ripped up contracts with insurers to charge patients directly, imposing $100 facility fees for overnight services. Nearly 50 doctors were caught systematically defrauding patients through fake no-gap fee arrangements while charging up to $5,000 extra for supposedly free procedures. But pharmaceutical price gouging in developed countries represents perhaps the most morally bankrupt aspect of healthcare greed. Abbott Laboratories sells AIDS drug Kaletra for $2,200 annually in Guatemala, where the average wage is $2,400. Think about that. The annual AIDS medication costs more than most people earn in an entire year. Insulin prices rose 1,200% from 1996 to 2003, while pharmaceutical CEO compensation increased by tens of millions, causing at least 12 documented deaths from patients rationing life-saving medications they couldn't afford. People are literally dying because they can't afford medication that costs pennies to produce but sells for hundreds of dollars. The medical device scandal spans continents. 1.7 million injuries and 83,000 deaths over 1 decade in the US alone, from devices that manufacturers knew were defective. Johnson & Johnson paid $4.3 billion since 2015 for defective hip, mesh, and surgical staplers, while executives received massive bonuses for hitting financial targets. The targets apparently didn't include not killing patients. While patients died from lack of basic medical equipment, healthcare executives awarded themselves compensation packages that would make feudal lords weep with envy. In 2024, healthcare CEO compensation reached new heights of obscenity. HCA Healthcare CEO Sam Hazen made $23.8 million, 391 times the median employee salary. Johnson & Johnson CEO Jacqueline Duato got $28 million, a 117% increase in 1 year. Tenet Healthcare CEO Sam Sutara pocketed $18.5 million, while his hospital struggled to afford basic supplies. The compensation structures explicitly reward profit extraction rather than patient outcomes. Tenet Healthcare's bonus system tied executive pay directly to revenue growth, creating systematic incentives for unnecessary procedures and cost-cutting that killed patients. During the Reading Medical Center scandal, where 20 patients died from unnecessary heart surgeries, top executives sold stock at all-time high values, while families buried loved ones. These aren't accidents or isolated incidents. They are features of a system designed to maximize wealth extraction from human suffering. When your bonus depends on cutting costs rather than saving lives, well, guess which one you're going to prioritize? Ralph de la Torre earned over $215 million during his tenure as steward, while at least 15 patients died from corporate negligence. That's roughly $16.7 million per documented death. If that's not blood money, what is? The evidence reveals systematic transformation of healthcare from healing into wealth extraction, with consistent patterns across corporations and even continents. Financial engineering over patient care, sale-leaseback deals, dividend recapitalization, and debt loading that creates unsustainable obligations while executives extract maximum wealth. Asset stripping, separating valuable assets from operating businesses when loading operations with crushing lease and debt obligations. Cost cutting that kills, systematic reductions in staffing, equipment, and safety protocols that directly cause patient deaths while boosting profit margins. Strategic bankruptcies, protecting valuable assets, and executive compensation while abandoning patient care obligations and community commitments. It's a business model designed to extract maximum wealth from essential services while externalizing all human cost. And it is working exactly as intended. Here's what should make you absolutely furious though. This isn't capitalism, it's sociopathy with a stock ticker. When a CEO can spend $40 million on a yacht while medical devices are repossessed from his hospitals, when private equity firms can extract $800 million while patients die from understaffing, when executives get massive bonuses for hitting cost reduction targets that kill people, the system has fundamentally failed its basic purpose. Ralph de la Torre and his yacht represents the complete moral bankruptcy of profit-driven healthcare. But he's not an aberration. He is the logical endpoint of a system that explicitly rewards wealth extraction over human welfare. The shocking truth is that these aren't bugs in the system, they're features. Healthcare corporations don't accidentally kill patients while making billions. They systematically prioritize profit extraction over patient survival because that's exactly what they're designed to do. Until healthcare executives face real accountability for the documented deaths that their greed has caused, patients will continue dying while CEOs sail away on yachts bought with blood money. The evidence is clear. Corporate healthcare greed isn't just immoral, it's systematically lethal, and it is getting worse every bloody day. Like and subscribe if this made you want to burn down the entire healthcare system and start over. Comment below with your own horror stories of corporate medical negligence, and remember, next time you're bankrupted by medical bills, at least you can take comfort knowing someone's yacht payments are up to date.